Hello, my name is Kunal Ileti and I'm a PGY2 internal medicine resident at Medical City Fort Worth. Today I'll be discussing a case of dapsone-induced methemoglobinemia in a renal transplant recipient. Methemoglobin is an altered state of hemoglobin which occurs when the ferrous iron in heme is oxidized to its ferric state. Methemoglobinemia may be acquired or congenital, with the former being difficult to diagnose and potentially fatal if missed. Dapsone is a common cause of acquired methemoglobinemia. Thus, given its prevalence, it is crucial to maintain an increased awareness while treating these patients. Our case is a 26-year-old Hispanic female with history of hypertension and MRKH syndrome who presented to the hospital 3 months after undergoing deceased donor renal transplant for a history of ESRD secondary to C1q and reflux nephropathy, for complaints of generalized headache, dyspnea on exertion, and bluish discoloration of fingernails and lips for 2 days. She reportedly started dapsone 7 days earlier for PCP prophylaxis following discontinuation of Bactrim. Physical exam was remarkable for cyanosis in the perioral area and bilateral fingertips. Her course was complicated by oxygen desaturation to 88% on room air with no identifiable pulmonary process. Also, genetic testing records showed no evidence of hemoglobin M disease, nor CYB5R or G6PD deficiency. An ABG showed pH of 7.37, PCO2 of 41.3, PO2 of 28, and bicarb of 25. Coaximetry revealed a methemoglobin level of 13%. She was treated with a single dose of 60 mg intravenous methylene blue with drastic improvement in her symptoms. She was also restarted on her vitamin C 1000 mg daily home regimen. Upon discharge, cyanosis had resolved, O2 saturations were maintained above 92% on room air, and methemoglobin levels had reduced to 4%. Dapsone was also discontinued. Here in our first image, we can easily appreciate the cyanosis observed on her fingernails. In our second image, we can observe the darker red, almost chocolate-colored blood that is associated with methemoglobinemia. Commonly acquired causes of methemoglobinemia include dapsone, anti-malarial drugs, topical anesthetics, and inhaled nitric oxide. Management consists of supportive care. However, methylene blue and vitamin C have shown therapeutic efficacy as well. In acute toxicity, methylene blue is appropriate due to rapid onset, whereas vitamin C may be used when contraindications to methylene blue exist. Methylene blue may be given at 1 to 2 mg per kilogram, and vitamin C has been reported as being given up to 10 mg intravenously. Interestingly, we speculate our patient may have had a less severe presentation from taking daily vitamin C. Why is all this important? Dapsone is widely used for PCP prophylaxis in solid organ transplant recipients. One study showed the development of methemoglobinemia in nearly half of study participants, and nearly 1/4 required hospital admission. Transplant patients are an immunocompromised population and have faced a myriad of obstacles, so we believe that monitoring of methemoglobin levels in patients with reduced renal function may prevent adverse outcomes. Alternative therapies include atovaquone or pentamidine. We hope to bring awareness in the management of methemoglobinemia with special consideration to the cautious use of dapsone in transplant recipients. Thank you for taking the time to listen to this presentation.